Consent is a voluntary acquiescence by a person to the proposal of another. Today? Great. Okay. As you know, today we will do the surgical removal of your lower third molar. So before we proceed with the treatment, I will explain to you the procedures, the risks and complications that might happen after the surgery. For the procedures, the first thing first that we'll done is I will give you an injection, local anesthetic injection to numb the surgical area so that you don't feel pain throughout the session. Okay, once you don't feel pain at that area, I will start by cutting your gum, lift them up, and then I will remove the bone a little bit to expose your tooth, and then I will section your tooth and take them out. Okay, and then once all the tooth fragment is already take out and remove, I will control the bleeding and suture them back. Okay, once the procedure is done, I will give you the post-operative instruction care for you to follow and understand. This is very important so that you can have a better healing and fast healing. Alright, next I will explain to you the recent complications that might happen prior to the surgical removal of the molar. For the first one is bleeding. Bleeding can be caused by a lot of factors. For example, is injury to the blood vessel due to chewing hard food or consume warm food after the surgery is done. Also maybe due to the underlying disease such as bleeding disorder. However, it is usually very common and it lasts for a few hours. If it is lasts more than 2 days and it is also profuse, you should come to us and we will try our best to stop the bleeding. The next complication is nerve injury. If you happen to have nerve injury, what will you experience is numbness to your chin, your lip or even your tongue. Okay, for your cases, this is the radiograph we took before. This is the tooth that we're going to extract today, and this is the nerve canal. You can see the tooth quite near to the nerve canal, so there are high chance to develop the nerve injury. However, we'll try our best to be careful as we can so that we can reduce the complication. Alright, next is infection. Infection may be due to the contamination of the instrument or poor infection control. Thus, to prevent it, we might give the prophylactic antibiotic to prevent the infection. Alright, next complication is the dry socket. Dry socket is the pain pain at the socket associated with the bad breath. Okay, the causes of dry socket usually due to the vigorous rinsing of the mouth after the surgery is done. Thus, the clot that happen at that socket will detach and it will delay the healing. So usually it occurs after 3 days of the surgery up until 10 to 15 days. So to prevent this, whatever the post-operative instruction we given, you need to follow and understand so that you can have the better healing. Other complications are fracture of the jaw, fracture of the root of the tooth, broken instrument, and also damage to the adjacent tooth structure. This usually due to the improper technique used, lack of skill, and then not suitable instrument use, also excessive force. Not least, trismus, which is difficulty in open your mouth, and also swelling. This too is quite common after the surgical removal of your third molar. However, it will subside after a few days. Do you understand the procedures, the risks and complication that I explained just now?
Yes.
Do you have any question after that?
I don't think that I have, so I understand all.
Okay, if you say so, you can sign the consent form and we will proceed with the treatment after this.
Okay.
Alright.
Yes,